Welcome to the module 14. This is a very important module for all our physicians because sometimes we're confused whether the AI is thinking in the right way or wrong way, or it's just a gut feeling of the AI. You may call it as a black box or a hallucination. This is an important dilemma which comes across most of the physicians' minds. To enlighten about this topic, we have uh, two eminent speakers, Mr. Srikanth Sampara, and to moderate this session, we have Dr. Ashwin. To introduce the speaker, Mr. Srikanth is an eminent technocrat. His journey spans across big fours like KPMG. He was consultant there. He traveled across the globe. He's one of the first people to start working on the wearables way back in 2014s, 13s. He started teaching about these things to most of the people across the globe. He currently works at the intersection of medicine, technology, and wearables and predictables. To introduce our moderator, Dr. Ashwin, again, he's a seasoned professional who was very important in designing the curriculums at Apollo University. Currently, he is the director of one of the last mile the medical delivery systems called MedUnited, and he is one of the people who adopted the technology in the last mile, that is villages, where people think it is impossible using a command center. Mr. Srikanth, tell me what you're going to teach to our people.
In today's world, the choice is not about whether to use AI or not to use AI because it has almost become part of daily life. Even before a clinician starts his morning day with a cup of coffee or tea, he is already using some sort of an algorithm or another in his practice. The question comes is how to trust these models. Can they make a clinical decision around the what you call the output or the score given by a particular algorithm? So today's topic becomes relevant because it's not nice to have, it is a mandatory evolution to have that a clinician understands the difference between a glass box models, a black box models, and explainable AI. In short, explainable AI is called XAI, which is predominantly useful, especially in highly regulated environments like healthcare, banking, and others. In the context of healthcare, just a quick example is clinicians are already used with scores like MELD and CAD and all that stuff. Those are called glass box models because people can easily look back and say why a particular risk score is high or risk stratification is high, medium, or low. They can look back. That's glass box model.
Right.
However, the ceiling is there is a ceiling to glass box models. On the other extreme are black box models, which are actually a kind of worrisome because if they make a mistake, the mistake is not realizable. Because the algorithm is trained on historical data, millions of parameters, nonlinear transformations inside the neural network, and the output is there. So that is another extreme. Is that not useful? The answer is yes, it is useful in certain cases where you can rely on black box models. In today's session specifically targets on explainable AI, black box versus what is explainable AI, and how to make use. And within 30 seconds for a clinician, if someone presents a model or an output, how can he distinguish between glass box, black box, and explainable AI and apply his clinical decision making on top of what the algorithm is suggesting? That is the essence of today's theme, and by the end of this theme, the aim or objective of this session should be a clinician should be able to determine quickly, effectively, what model is useful and how and when to use which ones.
Great.
Dr. Suresh, back to you.
Absolutely. Thank you very much. Dr. Ashwin, you are a practicing physician by yourself, right? So how do you feel that we should use it? Why should we doctors know about it?
So it's very important to understand these two models. The terminology is also quite interesting here. So any doctor who is dealing with AI in healthcare, so they have to understand these two models, black box and white box. So here, any AI model will give an output. And if the output can be explained, it's called a white box model. The output cannot be explained clearly by the AI model, it's called a black box model. So just for an easy understanding, I'll here quote an example. So if you are looking at an X-ray and the AI model reads it as a possible pneumonia, but it's not able to give the reason why it has given it as pneumonia, that's a black box model. But if the AI model understands few more parameters like the white blood cell count or the clinical parameters, like say the patient is having fever, the white blood count is more, then it is actually explaining why it is giving the reason as pneumonia, and that's called a white box. So both of them are very critical in the clinical decision support. And as the speaker explained, in some cases, they cannot be explained, but still they are very useful. And the other problem with the black box model is you cannot audit them because you don't have the reports. So, for example, in our hospital system, we innovated something called an AI-enabled pharmacy inventory management system called RAC IQ. So, in that, that's a white box model. So here, because it clearly reads everything and there is a count of everything, like the stocks or the fast-moving drugs or the slow-moving drugs, everything is calculated by account. It can be clearly explained and it can be audited. And that's a white box system there. And this is very important because if a decision is made on this, you have to realize that whether you will be able to defend that with the AI model or not.
Great.
So that's the understanding every clinician needs to have.
Absolutely. We would like to hear more from you this Wednesday, 4 p.m. to 5 p.m. Stay tuned and over to you, NBMS. Thank you.